I almost never bring back a guest, but I brought back a guest. Thank you so much. Karen Siebert, RDH MA. Karen is a part-time clinical instructor and adjunct faculty at the College of Lake County in Waukegan, Illinois, teaching courses in oral pathology and the dental hygiene process of care for patients presenting with medical concerns, special needs. She is a 1985 graduate of the University of Iowa, BSDH, and a 2012 graduate of the University of Illinois Springfield with an MA in educational leadership. Prior to finding her passion in dental hygiene education, Karen practiced clinically, implementing non-surgical periodontal programs and managing dental hygiene departments in 2 practices. Karen's career endeavors have expanded to include lead clinical educator for American Eagle Instruments, writing, presenting curriculum for continuing education courses and webinars, as well as articles focusing on both clinical applications and current technology that help us serve patients with the highest quality of care and achieve career longevity for ourselves. She is a member of Career Fusion, ADHA, OSAP, and ADA. Volunteer positions include state membership chair for IDHA and screening co-chair for the Northern Illinois Oral Cancer Foundation. And when I found out that she's from Chicago, that she was coming to the Valley for other reasons, I said, you got to stop by my home, and thank you so much for coming by.
Thanks for having me.
It's an honor. Being a dentist, I probably spend too much time on Dental Town. Since I'm not an orthodontist, I'm never on OrthoTown.
Oh.
But our third website, our other website, which we had after Dental Town but before OrthoTown, is Hygiene Town.
Yes.
And I always get a gazillion requests that you have too many dentists and not enough hygienists. So it's an honor to have you come back. And there's so many things we can talk about. I know that you want to talk about all this stuff, and we'll get to that. But I just want to start off with my my column this very month, which was about a hygiene department. Which one of the things that grinds my gears is the dentists are always asking about how do you get new patients? How do you get new patients?
Yeah.
And when I got out of school in '87, the average overhead for dentists was about 50%, and no one did advertising.
Right.
And 30 years later, now people are spending 3, 4, 5, 6% of collections on advertising.
Wow.
And I look at the hygiene department, and I see the average hygienist works 4 days a week, Monday through Thursday, 8 to 5. The average person gets their teeth cleaned twice a year. The average hygienist gets 2 weeks vacation. So 32 hours a week times 25 weeks half a year, she can clean 800 people and then come back the second half of the year and clean 800 again. So then that average dental office gets 25 new patients a month, which 800 divided by 25 means every 2.5 years you'd be adding another hygienist. Yet I go back to dental offices 10 years later, they still got the hygienist Karen Siebert working Monday through Thursday, 8 to 5.
Absolutely.
So it's mathematically certitude that every time you give your hygienist 25 new patients to clean, 25 old ones fell off the schedule. Yeah. And then they're all sitting around thinking that the bad guy is corporate dentistry like Heartland or Aspen or Pacific. I'm like, dude, you haven't kept any of your patients for 40 years.
Right.
So who's the bad guy? Oh yeah, it's got to be Aspen and Heartland because you've had the same hygiene capacity decade after decade after decade. Now you probably know, you're a hygienist that probably knows more hygienists than any hygienist I know. You've been in this business a long time. Why do you think every time you give a hygienist a new patient, an old one comes off their schedule and never comes back to the dental office?
I think there's so many reasons. One of the main ones, though, is the lack of teamwork I see in dental offices these days. You know, it seems like everyone's functioning in their own little bubble. We've got the dentist bubble, and then we've got the hygiene bubble and the front office bubble. And if the three don't work together, my best experience was my office when I was first out of school. I worked there 7 years and ran the hygiene department. We were a real team. And we rocked production, we rocked new patients, we kept adding those hygienists just like the Matthew just did. So it can be done. And I think that it's called communication and teamwork more than anything. And also I don't think dentists understand how much hygienists can help their practice, and that we know a little bit more probably than dentistry might think. I went to school at University of Iowa, like you said, and we were in the same school with the dental students. Those dental students seemed to really understand that they needed hygienists to be a team with them and that we could really help each other grow a practice. And any dentist I've worked for that had come from a program where they went to school with hygienists really seemed to get that as well. Since we pulled hygiene out of those dental schools, I don't see that as much anymore. So I think that's also part of it is we as hygienists have not done a good job of relaying what we can do to build a practice. And many of us maybe don't have that business skill in the first place. So we need to up our game a little bit, learn some things and learn how to communicate how we can help grow a practice.
And you know what's funny is I have my fellowship in the HD, my mastership in the HD, my diploma in the International Congress of Pathology. I have all that stuff. And I don't want to talk about that. I want to talk about, and then whenever I talk about the real stuff, like why didn't none of your patients come back, they're all going to say, well, that's fluff. Like if we put a continuing education course on Dental Town about a root canal, like endodontics, we put 3 up by Cock and Brave. Man, they were viewed 10,000 times each right out of the gate. And then you put up an amazing course of like practice manager, like why did none of your customers come back? Why is it going to take you to your 50 to pay off your student loans? And they go, that's fluff. I don't want to do that.
Yeah.
I just want to get right to the tartar and the calculus and the bonding agent. And
that's our problem. We need to be more well-rounded in dentistry, hygienists and dentists. And really, we all need a little bit more business acumen and learn how to work together a little bit. And one of the courses I do, I put a little piece at the end of it to help hygienists put together a business proposal for what they want when they need something in their practice to help treat their patients. And I teach them how to do that so that they don't just run back and go, I want this just 'cause. You know, you really have to have a good reason behind what you're doing.
So we sell the invisible. I mean, you know, when you go buy an iPhone, you know what you're getting. When you go buy readers at Walgreens, you know what you're getting. But when the dentist tells you need a MO and a DO, you don't know what that means. And when he tells you you need a crown, you don't know why he can't just put a filling. When he says you need a root canal, they don't know. So you got to have trust. And the only way you're going to have trust is long-term staff. So I want to ask you, I'm a dentist. I've employed hygienists for 29 years as of yesterday. And when a hygienist leaves, I talk to every office manager. They call up and say, yeah, I want to make an appointment with Karen Siebert. Oh, she's no longer with us. I'll put you with the new hygienist. And they're always like, well, where's Karen?
Yeah.
Where did she go? So my question to all these dentists out there, why do hygienists fire their boss? Why do hygienists leave? What makes them unhappy? Successful people are those willing to have the most number of uncomfortable conversations. So a social animal just doesn't want to go there, and they just soon... It's kind of like when you leave a horrible restaurant. They say, well, how was everything? You're like, let's not even go there. You're just like, fine, great.
Right.
Why do hygienists fire the dentist?
Oh gosh, there's so many different practices in so many different ways, but when you find a practice that people have been in for many years, you'll find that they have a very good communication style with the dentist that they work with. The dentist trusts them and shows that they trust them, and they give them latitude to have a little bit of decision making, in the patient treatment. And they don't have to just sit back and say, oh, we have to wait for the doctor to come in because I just scrape teeth. When we can empower those on our team, they're going to give you back, what do you think, 100-fold what you empower them with? My favorite office I worked in did that, invested in our education. We did a lot of fun courses. We would go see Zig Ziglar, so this is, back a ways, but it was so much fun.
You're giving away your age.
I know,
that guy
right?
passed away.
I know,
they can get on Google and find out.
Whoops, sorry guys, but yeah, we would go see him, and it would just fire everyone up. He'd take the whole office so that everyone was on the same page. And when you take your staff with you to things and you all grow together, you're going to really shoot out of the gate so much more so than if it's just you. I also know dentists that invest in their own continuing education, in their own equipment, for example, in their practice, and never do anything for their staff. And that's pretty demoralizing to a staff member. It really says something without saying anything, that they don't value what we bring to the practice, and that they don't admit that we do help retain that base. And that is not every dentist at all, but the ones that do that, they'll have staff turnover quite often. One of my things with being an educator with American Eagle is that I'm really finding that many hygienists will come to me and say, my dentist won't allow me to buy new instruments. And I just think, oh my goodness, allow. These are class 1 medical devices that we have to do, we need for our job, that we have to do the best work with a sharp edge on our instrument, just like a dentist needs a very sharp new burr. I don't think there are any dentists out there that would overuse their burrs. You would replace them because you always have to have a good sharp one to do the best job. Same thing with our class 1 medical device scalers. They are something that have to be maintained and have to be in good shape. And these hygienists are even afraid to ask for the equipment they need to do the best job for that dentist patient. So it's frustrating to hear that dentistry doesn't understand what we're doing with our scalers. And I think partially, again, I go back to hygiene being at fault as well for not communicating what we do as well as we could.
Yeah, and I want to, if you're a dentist listening to this, I mean, the hygienist knows what she's saying, but the dentist listening to this, when you're paying a hygienist and they're working all day long and they're using something they don't like, and they're seeing you drive to work in a BMW and live in a nice home, and it's a morale killer. In my office for 29 years, I have the assistants order the supplies for me and the dentist, and I've always had one of the hygienists order supplies for the hygiene department, and I just think it's arrogant for a dentist. I mean, imagine if your hygienist ordered all of your endo files. You would think that was ludicrous, and I'm not talking about the amazing rapper Ludacris. I'm talking about the bad Ludacris. I mean, your hygienist wouldn't even fathom to say, "Oh, doctor, I'm changing your gloves and your endo file," but you do this to hygienists all day long. And another thing about and back to the patient. So you go in there and say you need a root canal and a crown, and they know that you pulled up in a $98,000 Shelby F-150 pickup truck and live in a mansion. And when the hygienist says that you need a crown, it's 10 times more believable when you're selling the invisible. And then the dentist will say to me, well, they legally can't diagnose. Dude, how many hygienists are in prison today from diagnosing and treatment planning? I believe that would be none. So
Howard,
I've
read when you've written that before, and I think I jumped up and down and cheered, actually, when I read that. I just thought it was the funniest thing, for one thing, but then so spot on, because we are taught everything we need to know to pretty accurately assess what's going on for a patient, and we can certainly bring it to the point of almost diagnosing so that you are ready to go. The best practices I've been in, I've had everything written down and ready to go, that the doctor has come in and been so succinct because he knows I already set that patient up for all that treatment, and that patient is trusting me because we have a good relationship, and they're in and out. They don't spend a lot of time in their hygiene exams, and yet those patients come in for their treatment.
And it's the same with me for like even my assistant at that level.
Yeah,
she didn't go to school 4 years to be a hygienist. She went to 1 year of school to be a certified dental assistant. Jan's been next to me for 29 years.
Oh, and she knows
100% of every toothache emergency, x-rays, diagnosis, treatment plan. I mean, I can't even remember the last time she was off 0.01%. I mean, yeah, it's so much more believable when the dentist says, "Wow, I'm sorry. I know Dr. Farran can't save that. I mean, he's going to come in and look, but he can't save that. So you're going to have to pull it.
So much more believable.
So if you're going to pull it, here's our options. And they're never wrong.
It really is true. And what's happened there is you've empowered your staff to do that for you, and they're willing to do that on steroids because of that. They'll do anything for you. I can guarantee that, because you've allowed them to use their talents the way they should.
So how long has Lewis Myers been with American Eagle? He's my buddy.
Oh, about 5 years.
5 years. And how long's American Eagle been there? Like
25.
25
In 2017, it'll be 25 years old.
now, Americans know it as American Eagle, but if you're in Canada, it's called Canadian Hawk, and if you're in Mexico, it's called the Mexican Dove. So
right.
It's an international audience. What's got you so excited about American Eagle? I mean, there's so many companies.
You know,
that you
it's
could be
interesting
working with.
because I've been a hygienist over 30 years.
And by the way, let me say one thing. If you're a new listener, there's no advertisements, there's no money. This is a total hobby of mine. There's 24 hours a day. I do 1 hour every day. I love it. It's fun. She didn't pay me. American Eagle. There's no money changing hands. So don't ever think you're listening to a political advertising. But anyway, what's got you excited about American Eagle?
Well, having practiced
Is it because
so
you're
long-
American?
Yeah, no, it's not because I'm an American, actually. You wouldn't believe how excited people are in Europe about these. What happened is a friend of mine actually threw them on my tray when I was working with her one day. She said, "You have got to try these instruments." And I looked at her and I said, "I have tried every instrument out there, and there's no way it's going to be any better than anything else." And besides, I was, thinking, "Oh my goodness, I educate, so I know, right?" Which is probably one of the funniest things I've ever thought. So I had a very tough patient that day, and she said, "Getting a little behind? Is that tenacious calculus?" I said, "Yeah." And she goes, "Try these now." And she plopped them on my tray, and there were these gold instruments. I'm like, "Oh, all right, now they're contaminated. I might as well try them." And the minute I picked them up, they were really different. They were lighter. There was just something about them. So I went to try them, and I realized that I could lighten my grasp and really just plane this calculus away. It was kind of melting off like butter. I'm like, and the patient thought I was crazy because I kept going, "Oh, wow. Oh, wow." And he's like, "Yeah, you having fun with those there?" It was pretty funny. So I was like, well, there's something to these. These are definitely different than my stainless steel instruments I've always used. And as luck would have it, I ran into Lewis Myers soon after, a few months later. And
Was it
met
at a
him.
bar? Admit it.
It was not in a bar.
Really?
It was at Career Fusion, actually. So,
Really?
And I went for the professional retreat, Career Fusion. But no, not in a bar. So, no, he'll be happy I said that probably, huh? So at Career Fusion, I learned more about American Eagle, and I learned what XP technology was specifically, and that it was different than stainless steel. I'm really, now that I know as much as I know about it, I actually call it a second category of hand instruments because it's a completely different metal than what we've used before. So, like with our Cavitron tips, we have piezo options and we have magnetostrictive options. Well, with hand instruments, we now have stainless steel options and we have XP technology options, which is a plasma vapor deposition process that makes that metal, and it recreates, actually embeds a whole new metal into the top layer. Unlike a coating, it always sounds like a coating when we talk about it, but it's actually atoms remixing and creating a whole new metal on the top of this instrument. It makes it much harder. When we've got a harder instrument, it wears much more slowly, and we don't have to sharpen it because that way it'll stay sharp long enough that it'll retain its edge and its 70-degree angle, and we'll not have to worry about burnishing calculus, anything like that. So that is what I've realized after trying them and having my friend throw them on my tray, and she definitely taught me a lesson to be a little more open-minded at that
So
point.
the harder metal is scales easier.
It does. It scales so much more easily that we actually have to modify the technique, which is part of why education has come into play so much with this new hand instrument technology. Because if we scale the same way as hygienists that we do with stainless steel, we would overdo it. We could probably even damage the tooth because it's hard enough. So you use it much more like we use an ultrasonic scaler with a light grasp, and we shave from the outside of the calculus to the tooth surface, which sounds like you could leave some or burnish, but because of that tactile sensitivity that hard metal gives you, you can feel exactly where you are and what you're doing. And the tips are made thinner too because they don't have to add extra metal to shave it away, to sharpen it away. So you could really get to things we've never gotten to before with them.
So you and I have lived through the whole implant revolution.
Right, yes.
When you and I got out of school, it was maybe an occasional subperiosteal or ramus frame, and now a hygienist can't work a single day without being around an implant.
Yeah.
And with periodontal, so talk about these with implants versus natural teeth.
yeah.
Because in the evolution of this, the first they told us, you can't scratch the implants. They gave us these plastic instruments.
Right.
So you're talking about these are better because they're harder. The plastic was, you might as well just use it to scratch your back with. I mean, well, so
Right.
talk about the.
Okay, implants are a whole nother topic. XP technology should never be used on an implant. It's much too hard. The implant instruments that American Eagle makes are an interesting story too. And I've learned so much. In fact, on the plane on the way here today, I was reading about implant maintenance and what to do because it
Okay,
really
total
has
nerd.
I am,
Reading dentistry on your vacation getaway weekend in Scottsdale. She's
I'm busted.
reading.
I am
she's
so
reading
busted.
dental articles.
Yeah, I'm really
on her
geeky.
way to her vacation.
all my friends are rolling their eyes and saying, "That's typical." So, yeah, I really was. I admit it. I was definitely reading up on implant maintenance. So, because it's become such a controversy, there's speakers out there saying, go ahead and use stainless steel instruments on them. It doesn't matter if you scratch them. Well, every textbook out there, every evidence-based meta-analysis of the articles that are out says, bottom line, don't scratch these. Don't give more space for bacteria and biofilm to adhere. You know, when you really think about it, if a textured implant is there, well, texture is one thing, but if we actually make a scratch to a bacteria, that's like a big riverbank. I mean, that's just creating a really big party space. So, bottom line is don't scratch those implants. And there's quite a few articles out
So
there.
would you
now
recommend
about
the
this.
soft plastic then?
No.
Because that's so soft. Do you even
They
think
don't
those?
do anything.
I don't even think they
No,
work, do they?
No, they don't work. And the other evidence that has come out, and this was part of my reading on the plane, was a meta-analysis of articles about what happens when different materials are used on the implants. And there were scanning electron micrographs of plastic being left on actually kind of embedded in the titanium itself of the implant. And graphite was left on there as well for the graphite scalers. Then there were a lot of scratches with the stainless steel. Titanium did the best. But titanium, if it's harder than the implant itself, will scratch as well. So it's really tricky. What you need to use is actually medical grade 4 titanium, and it has to be softer than the implant. So what American Eagle did is they had made an implant line, a scalar line, and they had, when they really started learning about this, they decided to test, just like they test the hardness of a XP scaler and say how hard it is, they decided to test the hardness of an implant. And they took about 12 of the most popular implants out there, and Rockwell Hardness tested them. They discovered when they Rockwell Hardness tested their implant instrument in titanium that it was harder and it would scratch the implant. So they scrapped the whole entire line and they made a new implant scaler. They went and they decided to find a whole new titanium, and it was medical grade 4 titanium. And they were able to make it softer than the softest implant. It now comes in at a 23 on the Rockwell Hardness scale, and the implants average 30 to 35 or so. So hopefully it'll stay soft enough for all the implants that come out from here on out as well. But many of our implant scalers that are out there are not that soft.
I read a very similar study yesterday. There was this girl named Goldilocks, and she said one of the beds was too soft, and one of them was too hard. But then she found this one bed that was just right.
Yeah,
and that
right.
bed was the M4 titanium bed. Is that what you're saying?
Yeah, pretty much. Yes.
And
yes.
So
Sounds
XP
like
is kind of interesting because XP stands for Extreme Performance, and P90X, the most popular workout, was Performance 90 Extreme, right? Was that was
yeah, I don't know if I knew that.
So did
but
they
that would
steal
make
that
sense.
name? By the way, I want to say
No.
one thing. I got an interesting email the other day. It said, "Why do you refer to sometimes you call people Americans in another country when America, she said, could be North America, South America, Central America. And I've actually thought about that. I've lectured around the world, and I ask people, do you think of my country, what do you actually think of it? Do you call it United States? What do you call it? And almost everyone says they refer to the United States, they call it America, almost wherever you go. And there's other countries like that, like if you go to Netherlands, some call it Holland, some call it Amsterdam.
Right. That's true.
A lot of it doesn't really matter what your name is if everybody calls, if everybody calls you. It's like it doesn't matter what my name is when my mom's going to call me Howie.
Yes.
So yeah. So interesting deal. So we talked about the around the implants. Periimplantitis. Like I said, we lived through this implant revolution, and I think one of the most strange things in dentistry is that there's not even agreed upon definition of periimplantitis of failure, because the problem is with the patients is grandpa comes in, this implant's rock solid. I just ate a bacon cheeseburger and onion rings, and now I have this hygienist telling me that this implant needs to come out and I need to replace that. And you're like, I'm not paying $3,000 to take out a perfectly fine tooth. So my question is, what are you doing for periimplantitis? How are you treating this? And even if you decide it's got to come out, it's a hard sell to tell grandpa that he's got to have a $3,000 tooth come out when he could bite your finger off with that supposedly bad tooth.
So with periimplantitis, what I've been reading is that bacteria probably got in there during the placement of the implant itself. Have you been reading that too?
Yeah, and not to get you off, but what made sense to me is that the baby is not born with streptococcus mutans for decay, Pigionvalis, herpes simplex 1, HPV for oral cancer, all this stuff. And then you hand it to its mother, and she kisses it on the mouth, dad kisses on the mouth, grandma kisses on the mouth. And to me, it makes total sense that when they get full mouth gum disease, is to first take everything out so that Pigionvalis will probably die off. And plus you put them in removable, so it's kind of like I'm giving you 2 wooden legs. So you get rid of all the perio, you get them used to removable, and then you go back later and do an implant because now you've taken it from here to rock bottom to back up. And a lot of the periodontists, they don't see it that way. They'll say, no, the Pigionvalis would still be living in your gums, below your gums, in your tonsils. But placing an implant when the tooth next to it has a 6 millimeter pocket.
Yeah, I'm more in your camp too. It really does make sense. It makes sense to really get rid of what was there first, like you're saying, and then work your way back to placing an implant. My dad just needed an implant, and it's been interesting to go. I drug him to my good friend that I know has a fellowship from ICOI, and I know he knows what he's doing. He's shown me all different cases, and he's doing a fantastic job, but he is taking the slow route too. He just sent me an email yesterday with some of the scans that he had, and he said, well, it looks like the buccal wall might be a little thin still, even after we placed enough bone grafting in there. So I'm going to flap this. I'm going to see if I can actually place the implant, but if it's not thick enough, I'm going to pack it again with more bone, close it up, and we'll place it later. So he's kind of working his way back, up to placing that implant, like we're talking about. We weren't dealing with gum disease on this one, but still he's being
So that's an older dentist. How old is that dentist?
No, he's young. He's way younger than me. 40, 45.
Well, that's an older dentist. I mean, you're talking. I mean, podcasters are 30 and under.
Well,
and,
true,
and the reason I keep reminding him is that one of the biggest mistakes when they get out is, you're the dentist dog wagging the patient's tail. But the young kids, the patients come in and say, no, I want you to place the implant and put the tooth on. I want one day. I want same day.
Right.
I Googled it I Googled this, and in 15 minutes I learned more than you did. And I want same day crown, same day implant, and it's only the 50-year-olds that say, well, I'm sorry, but that's not how we're going to play. We're going to place this implant, we're going to bury it, and I'm going to let it sit there for 6, 8 weeks, 3 months, whatever. I mean, you're the dog, you wag the tail, and every time the patient wags you, that's when you get into trouble.
It seems like it, because not all cases are the same. I bet there are some cases you can place them the same day, they work out beautifully. And that's great, but the ones that you can't, you just keep doing that same routine, treating everyone the same like a little mill, it's not going to work out in the end. Somebody's going to have, well, that's why the periimplantitis is probably as high a rate as it is.
Another question they're asking a lot is reimbursement is a game changer. So when you go to a country that only give you $100 for a root canal, they'll say, then fine, I'll do the implant. I won't do the root canal. Right now we have 82% of America on a PPO. A lot of hygienists that you're talking to right now, the dental office has found out that you get reimbursement if you place a perio chip, a chlorhexidine deal,
Right.
minocycline,
Right.
whatever. So some of them are, some of them don't know if they're hygienists, if they're doing that because the office is trying to make money or because it actually works. What's your honest Dentistry Uncensored truth of localized agents in periodontal pockets?
Well, that was in one of my articles this morning too, one of my nerdy moments. And they are recommended to put around implants. I personally haven't had the best experience with placing those chips. I feel like they work for a while, and then once they aren't there anymore, the pocket regresses again because that bacteria just recolonizes. But reimbursement is a big deal. We get paid to do those. So they are going in more and more. I am not 100% up on those, especially because of the last few years. I've really been in an academic setting much more so, and we don't place them at school. So I'm not all there. But what I have read with implants is that is an option to help them through the healing phase and to get them going well. And then sometimes to try to save them rather than taking them out and replacing them. That also seems to be a mode that is viable from these articles I was reading today. And they were all evidence-based.
Yeah, I was talking to, I was doing a podcast yesterday with a friend of mine from Chicago.
Yeah.
And we were reminded back in the day when these people would have subperiosteal implants, and
Right.
they loved them, and they were just a sea pool of pus, and you just every time they came in, you just kept giving them antibiotics. Do you ever see situations where in treating their gum disease or periimplantitis around a systemic antibiotics? Do you ever do that anymore, or do you not?
That's been coming into play with the recommendations as well. The rounds of systemic antibiotics, especially the low dose, so you're using it more as an antimicrobial than you are as an antibiotic. That seems to be working very, very well.
And the minocycline is one of the chips.
Right.
Back in the day, they used to like tetracycline because it showed up in skin more concentrated, like 7 times more concentrated than penicillin. But is that what is the thinking today?
The minocycline, well, doxycycline.
For systemic.
For systemic, what is
when
I know
you
it's called perio. What was the prescription word it was called?
Well, the perio chip was minocycline.
But the one you actually took it was perio.
What?
Oh, I'm going to forget the name of
The
it.
antibiotic?
Yeah.
Was it doxycycline? Was it minocycline?
I think it's a doxy.
Doxycycline?
I know doxycycline is added topically
Yeah.
quite a bit. I know more about that topical part. There was the systemic one that was very popular, and then it sort of has fallen off, and now it's resurging again. And it has perio in the name. I can't remember.
So you've basically, I know that Lewis said that your hands-on courses have exploded, and you don't even have enough time to do all the ones you're invited to.
Right.
So tell me what you're doing with the hands-on courses, and why are these so popular?
They've been so much fun, and I think I like doing them because I feel like I'm just with a bunch of friends. It's just what I do. It seems like school almost. We bring typodonts. They're full of calculus too, so they're ugly. They're all black calculus all over them, and hygienists love that. So as soon as we open those containers, everybody's working away to get them spanking clean. So I have to replace all that calculus again before the next class, no doubt, because these are good hygienists. So they get to try the actual XP technology hands-on with some fake calculus on a typodont, so they can get the feel of that modified technique. I'm able to listen to them and when you're modifying the technique for XP, you actually can't hear it as much either. So if I hear someone really going, and I'm like, you're going too hard, so slow it down. So I'm able to kind of coach them rather than them just kind of winging it when they go.
No, is this a 3-hour class, an all-day class, half day? What is it?
It can be altered to anything. I've done 2-hour classes that we just take a few instruments with us, and that's all we can get through once we explain the technology behind XP and how to reprocess them and things like that. Or the other day I did a 3-hour course in New Jersey for the Southern New Jersey Dental Hygiene Association. They were fun. Thanks, guys. They were awesome. And we took a big cassette, and we had about 10 instruments in there. So they were able to try all different instrument styles maybe they haven't had before. And XP has some unique instruments anyway because they don't have to be sharpened. They're able to make things called double Gracies. So double Gracies are actually 2 instruments in one, and each working end is an 11 and a 14 for the posterior Gracie, for example, and a 12 and a 13 on the other end. So you don't have to flip your instrument. You're using it like a universal, but you get the Gracie access, which in hygiene land, that we all know that that's the most beneficial instrument to use to get the whole pocket covered. So it's also more time consuming because you're constantly changing out instruments, and the double Gracie eliminates that. So that's
So you were in New Jersey?
I was.
There's
yeah.
only 2 types of hygienists in New Jersey.
Really? Uh-oh.
Half dream about Bon Jovi and the other half Bruce Springsteen.
Oh, we did talk about Bruce Springsteen
Well,
because
did you have a
he had
Bruce?
just been there.
Oh, really?
Yeah, he had just.
He's from there and lives there, right?
Yes, and he had just put on a concert nearby, so I know we did have a couple of Bruce.
So what about
moments.
you? Are you a Bon Jovi or a Bruce Springsteen girl?
More Bruce Springsteen if I have to choose.
Really?
But, yeah.
Really?
Yeah, not Bon Jovi.
Not
No,
Bon Jovi?
No.
Sorry, but are you allergic to cats?
No, I'm not.
Okay, good.
Such a cute
And look at
cat.
her. I mean,
the rest
she's
of
so-
my family is.
Okay, if you listen on
Oh, so
iTunes,
it's good to have
Tigger,
kitty time.
if I start spending too much time on my email, she sits
She-
right in front of me looking at
Oh,
me.
she's your.
So she's,
she puts balance in your
So
life.
she's
huh?
laying on all my notes, so now the rest of this interview I'm going to have to wing. Hi, Tigger.
This is hilarious.
Tigger, am I talking to someone other than you?
Yeah,
Tigger does not
exactly.
like anybody other than herself.
That is
But anyway,
funny.
what is she doing?
Whoa,
Oh,
you're
she's
gonna
slipping
slide
on the
right
paper.
Off
That's-
the table. It's gonna
So
go
now she's
sliding
going to
right
smell
off.
your microphone. Okay, Tigger, why don't you just sit there?
Yeah.
And then lick my coffee. And,
Get a little buzz there.
yeah.
Oh my god.
But I don't like Tigger. You know why?
Why?
Because if she ever has the
beautiful.
choice to sleep in if Ryan closes his door, then she'll come sleep with me.
Oh.
But if Ryan opens his door, she'd jump right out of my bed and say,
Yes.
I'm done with you.
my dog does that.
So I guess Tigger's a cougar. And
there you
she
go.
likes the younger men, not the older grandpas. But you also doing webinars. If one of
We
my
do.
homies listen, tell me about what you're doing with webinars.
Yeah, the way we found that we can reach more offices and maybe train the whole team at the same time about these XP technology instruments is to do a 1-hour CE over lunch through like a GoToMeeting site.
Is that what you like to use? Go to
well,
me.
we do at this point, yeah.
And you like
That's
that
been
more in
working out.
Skype?
Yeah, we do, because we're using a PowerPoint. The bummer is you can't see the presenter, but we're really wanting them to see the slides. So that's been a balance there. Haven't really tried Skype. Did they put
Well,
the
Microsoft bought Skype for what was it, $8.9 billion, and so there's some big money behind it. Then who just bought
I should check
LinkedIn?
that out more.
Was that Microsoft just
yeah.
bought LinkedIn, and
I
a
saw
big
that.
part of that I think is they have the Microsoft Office. Now they own the LinkedIn and the Skype, and it's probably going to be merging all into.
Yeah,
I mean,
that's
they
gonna
got
be
a
a good
huge
platform.
Whenever
Education.
you pay $10 billion or something, you got an idea or a plan.
Yeah,
So
maybe
my
they'll come
homies
up with a
listen to
good-
you and
yeah.
they want to educate their hygiene department. They could have a webinar for their office.
Definitely, yeah.
So how do they do? What's the logistics? Who do
So
they call? Where do they
can
go?
either email me or email marketing@americaneagle.com, which
So
is
email marketing
Yeah, it's
at
probably the easiest
American.
way.
Marketing at. Is it American Eagle or
no,
AM
it's am-eagle.com.
dash Eagle? So marketing at am-eagle.com, and you'll put on, is it a free?
Yo, it's free. Yes,
it's a free
absolutely.
lunch and learn in your office.
Uh-huh.
So you could just send someone out to choke and puke and pick up some burgers and chicken or sub sandwiches,
yeah.
and then come back. And how long are they?
It's under an hour, so you can do it in the lunchtime, have some question time too, so we make sure you're back to patients in time.
And is this just for hygiene, or is it the whole office?
It could be the whole office.
But who's it primarily intended for?
Often it is just the hygienists, but
So then-
we recommend
so
the
what-
whole office.
You recommend, and why would
do.
you recommend the whole office?
Because it's such a different technology that when the hygienist tries to explain it to the dentist to ask to purchase them, he hasn't seen that whole process and seen the science behind it, so it's a little harder for him to maybe say, okay.
That's why I love Lewis Myers. The fact that when I wasn't using him, he flew down here and bypassed me and went straight to my office.
Did he?
Didn't even care. He just wanted to know what his hours were because he knew everybody would be there 15 minutes for. And he said, I only need 5 minutes with Howard's hygienist. And he gave him each a sample, and I just thought, man, what a go-getter. And then it was a really interesting deal. He's highly disciplined, go-getter. And then what was cool for me is he probably knew how a CEO thinks, and the CEO thinks, so I don't care what Lewis says, I want to know what my hygienist says.
Yep.
And the hygienist, it was love at first sight.
Oh, good. Yeah.
Yeah.
Actually, I'm going to go see them after this and see.
You're
if I
going to
can-
go there after them?
Yeah.
Wow.
I've been emailing with them, which is because the one thing I am concerned about is they never really got the education. Lewis gave them the sample, but they didn't get a piece of education. I'm so concerned that everybody knows how to
our
use
office,
them properly.
we do all the education through osmosis and diffusion.
Yes.
I just assume when I'm in there, it'll just leak out.
That's right. That's
That-
what
that's
happened.
highly effective.
It is. It works really well.
And it's cheaper.
Oh my God.
It's cheaper.
That's funny.
Again, we're both old enough to know Zig Ziglar. I won't give him your age,
really?
but I'm older than you. But we're both old enough to give Zig Ziglar. And the hygienist listening to you right there, and the dentist. All of our evidence is 20% are still in dental school, hygiene school, and the other 80% are under 30. So my question to you is, what do you think you know? How many years have you been a hygienist?
31 years.
And you're young, yeah. And I just celebrated my 29th anniversary of my dental office yesterday.
Yeah, okay.
So what do you
we're
think
about the
that what do you think that you know more than the hygienist who's just graduated from school? Well, what do you think you could tell her that instead of that she has to learn through the school of hard knocks? I remember some things are hard to learn. Like I'll never forget my oldest sister, who is a Catholic nun,
Nice.
told me in my pajamas, put your tongue on this nail. She goes, Howie, lick this nail. You're not going to believe it. So I did, and it literally knocked me on the floor.
Nice,
And yeah,
sister.
so that's a Catholic nun for you. Evidently, someone drove a nail into a wall and it hit something other than a 2x4. But what do you think you could teach them that they don't have to learn by licking a nail in their pajamas?
What's interesting is I teach the new hygienist all the time in school for my part-time adjunct faculty position, and I learn so much from them. I think that's always kind of fun too. So probably be willing to learn from one another, be open to new ideas. Definitely take as many continuing education classes as you can, even though some of the states don't even require you to for the first cycle of your licensure. Go above and beyond. Offer to be part of the team as much as you can. And look into some business aspects of the practice. Ask questions about how you can help make a practice run more efficiently. I think any dentist would probably appreciate that. If we're willing to put our heart and soul into it, they'll see that most of the time.
You know, I agree with you so much that, you know, when you talk about the meaning of life, it seems like one of the neatest thing about dentistry is just the patients.
Yeah.
And to have had relationships with so many people for 29 years.
Yeah.
And so many 80, 90-year-old men and women I've always asked, what is the meaning of life? So many of them said that the people who went above and beyond in their family and their career had much more happy and meaningful lives. And I think a lot of that is volunteerism.
Yeah.
You're a member of the American Dental Hygiene Association.
Yes, yeah.
A lot of hygienists say, yeah, but I'm married, I have 2 kids, I don't have time for any of that. And I always think, that's cheating yourself.
It is cheating yourself, and I wasn't for a while either, actually. So I've been a member, not been a member, and then been a member again, and I've really taken advantage of it this round. Maybe it's because I'm older. I realized that I could help out a little bit more. I've had so much fun meeting the people that I've gotten to meet through the ADHA, and talk about a group of people that goes above and beyond. These hygienists are there for one another. They're there for all of us to do better and to improve the dental hygiene profession in general. So I've had a lot of fun. I'm part of the membership committee and lead that for our state in Illinois. And it's a challenge because there are many people that don't see the value in being a member of ADHA. But again, on this one, I'd say just be open, give it a try, and just see what you think. Maybe it'll be for you, maybe it won't. But you'll probably get something out of it, and you'll probably get more than you think.
So did I ever, people think a hygienist is an all-girl profession. Did I ever tell you that my dad's brother, Mike, was the first male nurse in Kansas?
Really?
He was the first
wow.
one because
That's cool.
high school was over and my Aunt Shirley still wouldn't pay him any attention or whatever, and he was just so heartbroken that he'd never see Aunt Shirley again. So he found out she was going to nursing school in Parsons, Kansas. So he went to nursing school to be back in class with my Aunt Shirley. And of
No
the
way.
4-year program, it took till senior year before Aunt Shirley finally married my Uncle Mike.
Oh, that is funny.
But that's another thing that's changed in hygienists with the disappearance of 50 million manufacturing jobs and healthcare being the fastest growing segment of the economy from 0% in 1900 to 17% in 2015, and this year is the first time healthcare will pass $3 trillion.
Wow.
Are you seeing more men in hygiene than back when you got out?
Oh, absolutely. We had none in my class, and I don't remember any even in the classes around me. But every year, so I think we've had a male hygienist graduate since I've been with the program that I'm with, and last year we had 3 out of 22, so that's pretty significant. This year we have 1. So every year
And
there's
what
at least
is-
one male student.
And what is their background? Because for years, the few men that you would see actually would actually come from the Navy, because in the Navy they put 6,000 boys on an aircraft carrier, and then they put actually 2 dentists in there, and then the captain of the ship will say, "What do you need?" And he'll say, "Well, I need an assistant in cleaning." And they're just told to go out there and pick 2 people. So a lot of them, I say, well, you're a guy, how'd you get a dental assistant? And he says, I was standing in formation and the dentist just pointed at me. And next thing I knew, I was a dental assistant. Here I am 30 years later. Same thing I heard with hygienists. He said, well, I was a hygienist in the Navy with 0 training.
I've
and
heard
so
that.
when I got out of school, I decided to go to hygiene school, and the Navy paid for it. So what is the story on these guys entering?
Gosh, it's varied quite a bit. Many of them have come from, it really has varied. There's been a lot that have wanted to be a hygienist for a while. I've had a few of those. Some had just investigated all different healthcare options, and they think this is a good route to go to. It's a 2.5-year program plus the prereqs. You're almost at 4 years, but it's really a pretty good return on your investment to go to school. So I think many of them see it as a route to a good solid career, and that without going all the way through dental school, where you rack up so much debt. I think that comes into play a lot now too. I want to be in dentistry, but I maybe don't want to have $400,000 in debt at the end of it. So I think I'll go to hygiene school, see what it's like, see if I like it. And maybe I'll want to go on later, but maybe I'll remain a hygienist.
So in my dental school class of 87, most of the girls that were in my class were hygienists first.
Oh, okay.
And I thought they were so genius because their part-time job was Saturday. Now, my hygienists are paid $40 an hour today, but back in the day, 30 years ago, it was $20.
Yes.
So on Saturdays, I would go work at Walgreens for $3 an hour, and they would go work in a dental office for $20 an hour, learning about all the root canals, fillings, and crowns. But I thought the hygienists in my class skated through, because I mean, I remember literally sitting through the first class of endo in dental school, and the guy next to me says, "What is endo again?" And I thought, dude, you're in dental school and you don't even know what endodontics is. But the hygienists, they've been reading bite wings and pan. I mean, they've seen it all.
Yeah.
So I always tell people that
true.
if you're going to be a physician or a dentist, again, I know a medical student who first became a phlebotomist, and then all through medical school, he was making big bank. And a lot of them were nurses first.
Right.
And I think that why do you get a degree in biology or chemistry to go to dental school? Because with a degree in biology, you're working at Circle K.
Right, exactly.
You know, you're working at 7-Eleven all through dental school. Yeah. I want to ask you some controversial stuff. This is Dentistry Uncensored. So let's go. So what I never understood is let's just go really politically incorrect. Like the news is all obsessed with like terrorism.
Yeah.
But when you look at how many people are killed by terrorism, I mean, it's the same amount that's killed by lightning.
No.
Yet 30,000 die each year in their car. And we have an intersection in Waukegan, 48th and Ray, where someone's died every month for the last decade.
Oh my
That'll
gosh.
never make the news.
Oh my gosh.
But if someone was shot, it's headline news. And hygienists opening up their own business. I mean, there's like 7 that I've ever met in my life. But it's like 99% of all the noise that done it. Oh, they want independent licensure. It's like, okay, so you can't even keep, you've had the same hygiene capacity from age 25 to 65. You've still had one hygienist 4 days a week, even though you're getting 25 new patients a month for 4 decades. And you're worried about the 7 hygienists who open their... Why is that so controversial?
I don't know. I wish I knew more.
Is it because their mom dropped them on their head and never told them?
Potentially. That could be our only explanation, because I don't mean to be rude about it, but it really doesn't make sense, because any hygienist I know that wants to have their own practice, it's really to expand prevention out to people who can't get to a dental office in any way, or people who don't have insurance and just don't go because they can't afford it. So maybe they could afford like a mid-level provider opportunity to do some prevention. And gosh, when I think about it, all I think is, if I were to establish a practice, I would establish it near the dentist that I love, and I would make sure that I could refer to him. So I can't imagine what the drawback is. But I'm coming from the hygiene brain. So I know we went through a lot in Illinois, and we actually went a little backwards through the legislation process, because dentists were so adamant in our state about not even allowing a little bit more freedom to treat those that need access to care. It baffles me. I wish we could get it.
Pure insanity. Pure insanity.
And
what's funny is now that I'm 50, I mean, 29 years, I'm living this, so first it was hygienist, independent licensures.
Yeah.
Now we're going through it with the oral health therapist. So it's like, okay, so the sheep are spooked. They think there's a wolf walking through the pack. They're all rattled, and at the end of the day, nothing's going to happen. They're going to have 3 seizures and have to take high blood pressure medication. It's the same thing with HIPAA. I lived through this with OSHA. I got out of school, OSHA, everybody's all freaked out. Everybody's saying, did I ever tell my OSHA story?
No, I don't know. I don't think so.
So every OSHA lecture you're going to was saying something different. The dentists were all freaked out. OSHA was going to shut them down. HIV was AIDS. It was all it was all brand new. The first guy that died in my graduating class in 1987 died of AIDS.
Oh, really?
My ex-wife's best friend died right before she graduated from college. Everybody was all freaked out. And finally, I was talking to my dad. My dad said, well, if you're getting mixed stories, go to the top. Always go to the top.
Yeah,
call DC, call the top. So I left like 20 messages for the head guy of OSHA.
Oh, wow.
Finally returned my call. I'm in the middle of treating a patient.
Oh, funny.
I run for the phone. He said, how may I help you? And I said, and I told him the story. He goes, whoa. He goes, you're a dentist? And I said, yeah. He goes, why are you calling me? And I told him the whole story. And I'm like, well, why don't you just have an OSHA policy? Why am I buying OSHA policies from all these vendors? They're all different.
Right.
Why don't... And he said, Dr. Farran, he goes, I'm looking at it right now. He says, right now, 3 out of every 1,000 workers in American mining die each year. Construction, 2 out of every 1,000 die each year. Agriculture, 2 out of every 1,000 die each year. And this was right at a time where there was, the headline news was some kid got his arms cut in a combine and severed off both of them.
Yeah.
He goes, I'm looking at dentistry right now. It's 0.00 deaths per 1,000 per year. If an OSHA instructor walks in your office, you call me and I will fire his ass all the way from Washington, D.C.
He shouldn't be wasting his time.
I started laughing. And then 10 years later, now it's a HIPAA.
Yeah.
And, none of these dentists ever saw the OSHA man, and they're never going to see the HIPAA man.
Right.
And they're never going to see an independent hygienist across the street ruining their business. And they're never going to see an expanded oral therapist ruining their business.
I don't think so.
But monkeys always have to. It's the same behavior. It's like you go into Wall Street, 20% think the sky is falling.
Yes,
you go into religion, 20% think the end of the world is going to be, of course, in their lifetime.
That's right.
I mean, if God's going to come back, it'd definitely be when your egocentric, narcissistic butt was standing there, and it's the same behaviors that you just see over and over and over. And the same thing with corporate dentistry. When you and I got out of school, Orthodontic Centers of America was going to employ all the orthodontists. They were all going to be working for McOrtho and all this stuff, and it fantabulously exploded. There were 12 trading on NASDAQ. They all exploded. And then I go into these cities. Corporate dentistry will come in, like one will come in their town, and all the dentists are all freaked out. And after 6 weeks, you just a line of patients coming in. Well, I went in there and they gave me this $5,000 treatment plan to redo all my. And at the end of the day, business is a golf game. Just worry about your own game. Don't worry about boxing. You don't have an opponent. It's not HIPAA, OSHA, expanded function, hygiene, none of that stuff. It's, did you connect with your patient? Did you form a relationship with your staff? Do your staff stay with you? And do they develop long-term relationships with your patients? If I was talking to a hygienist, the only thing you should want to know from Karen is not anything about other than, how did that dentist keep you in that practice? How did he make it fun? How did he expand the hygienist from 1 to 2 to 3? And why were you guys happy and motivated so that your patients felt that contagious karma and wanted to come back? And he attracted hygienists that were turned on to hygiene. They joined the American Dental Hygiene Association. She's all excited about new technology. The enthusiasm is contagious. The patients find out. The patients believe you're an expert just because you're motivated. True. And that's what Zig Ziglar would always say. That people every day they need deodorant, brushing, flossing, and motivation.
Yes.
And he said humans need motivation every day.
Right. I really do think you're right. If you take care of your own house first, don't worry about all those other things on the outside. Get your own house in order, and your practice will flourish. I just can't say enough good things about it. Honest and clear with your patients, they're going to trust you right away. Sometimes if you don't think something's a good idea, tell them that, because that builds trust more than anything. I think you go, no, I don't think that necessarily works for you, but I think this would be a better idea. Boy, patients appreciate that.
Successful people are the people willing to have the most number of uncomfortable conversations.
Yes.
You're talking to a lot of kids out there.
Yeah.
So something's bothering them. She's a 25-year-old dentist or hygienist. The older dentist is an old, fat, bald guy like me. He's 54, grandpa. How do you give her a little coaching? I only got you for another couple of minutes. Give her some coaching about how. You're a hygienist. You're not happy. How do you have an uncomfortable conversation with the owner, operator, dentist? How do you do that?
That is a tricky one, and definitely something that was very scary early on. And it depends on your situation with the dentist, I suppose. But really, I think if you make a plan, lay out your pros and cons to what you have to discuss, think about whether it fits in for that practice and what you need and your goals. And if you go to that dentist and say, I really would like to discuss my plan here for helping your patients have the best experience possible, and there are some things that in my job description that just are not making me feel comfortable right now, or I would like to work towards being a better hygienist for your practice and your patients. Whenever you turn it around and make sure that that person knows, I'm here for you, and I want to improve myself to improve our end goal, our big goal of having our patients happy, I think they're going to be able to listen, and you're going to be able to have a normal conversation about something.
Would you recommend or not recommend sending the request for a meeting and sending everything you just said in an email? So some monkeys, would you send them all that in an email and saying, hey, Karen, here's my 2-page letter and all my thoughts. I'd like to meet with you.
I would not
You would
load
not.
up all those thoughts. I would say, I have some thoughts on how our practice is going and my role in your practice, and I would really like to discuss it with you. I have some ideas, and I'd like to lay them out for you. Can we meet together? Can we have lunch? Can we go do something? Can we meet in the office after work or whatever? But I have some ideas, and I'd like to run them past you. I'd like to share, my thoughts on how I can be a big asset for your practice.
Nice. I'm personally an anti-lunch guy.
Are you?
I'm an anti-lunch guy because I quit doing it over 10 or 15 years ago because when you put a plate of food in front of a monkey, he's all into the food and all this stuff. It's like, dude, go eat another time. I want to discuss. I think every meeting, every office should have a someplace to have. But no, some people like it. You're a social animal. So if I give you something, you give back. So taking someone to lunch is a reciprocity. Taking someone to lunch and telling them, I want to treat you to lunch. I'm buying, order whatever you want. They're going to be trying to please the whole time. But if it's an equal deal where we're not trying to influence, but it's more of an operational logistics, I want to get the food out of the way and just knock out the details.
That is really smart, and that's a good way to brainstorm together. I guess I think getting out of the office, is where the going to lunch part, because sometimes being in the office is, it's like having a discussion with your spouse in bed. You're supposed to avoid certain topics, right? Keep them out of your house. I
don't know. I got fired in 2005. I've been sleeping with a cat for 11 years. My cat... she's never argued with me once.
Well, that's a plus. That's one thing about cats; they won't argue back. But yeah, it's that you want to just move it out of the realm that you're normally in, but perhaps not with a meal. Somewhere, or even at a time when the office isn't open or everyone's not all there and there aren't patients coming up to be scheduled. Somewhere where you can kind of relax.
But but Socrates said we had 2 emotions. We had greed and fear. And we know scientifically that fear is bigger than greed because no matter how greedy you are to want to get a drink out of that pond, when you see 3 alligators sitting in there, you will sit up there till you almost die of the dehydration.
Yeah, really.
The 10 biggest drops in Wall Street dwarf the 10 biggest gains. So the bottom line, one last final question. I know we're in overtime. I'm just afraid to talk to my dentist.
Yes, and it is so common. When it really is about our own personal self-esteem. I've been shy my whole life, and I had a hard time too. And fortunately, I did have that boss that encouraged me to come out of my shell and go ahead and contribute to the office. And that was huge for me. It made a big difference. When you are afraid, maybe you want to role play it with another friend first and figure out if you've got the system down, if you know exactly what you want to be saying to them. But it is tricky, and if you are feeling fear with someone you work for, that's not good either. You should not, and perhaps that's somewhere that you don't want to be.
But a lot of the fear is hardwired because my mom, and dad, calling them Catholics would be a disservice to all the moderates out there. We call them crazy Catholics. I mean, we went to mass every single day.
Yeah.
7 days a week.
Yeah, wow.
For, from birth to 17. And the one thing that I always noticed the most, because you always had to think when Mass, because the first 10 years it was in Latin, so you had no idea what was going on.
You even had the Latin.
They're just sitting up there going, hey, oh, hey, oh. And, but the thing I noticed the most amazing is I never saw one person raise their hand, ask a question, argue, debate, anything told. That's the purpose of the stage. They do it at banks.
Yeah.
A bank, you're the customer. They only make a living because you put your money in the bank. They pay you 5%. They loan it out for 10, and that spread is how they make a living. But the banks try to flip that on you and make you realize and make you think, I hope they'll give me And by altering the stage, wearing the dress, the incense, the props, the whole 9 yards, no one will ask the question. So when you're a 25-year-old hygienist and the doctor's 50, and it's just socially hardwired, it's intimidating that, hey, because what biology is saying, because here's what it all comes down to. The 400-pound gorilla is how we survive. We're hardwired to obey the 400-pound gorilla because we all have to work together.
Right.
And if all the gorillas ran 20 different ways, we'd all be eaten by lions, tigers, and hyenas. So our survival for millions of years is based upon that. Until the 400-pound gorilla says we're going to cross that plains to the vegetation on the other side, you just don't move. So when you walk in that office, you're a 25-year-old, you're just a 100-pound gorilla. Yeah. And you're hardwired to do whatever the 400-pound gorilla says. And it's just hard to get your frontal cortex logic to override all that underneath reptilian cortex stuff. And that's why so much success is counterintuitive. And you listen to the birdie on your shoulder. And if this is bothering you, but your stomach's saying, I don't do it. But learn to listen to that body. When that little birdie says, I wish I could tell him this. Well, then you tell him that. And that's where gossip comes from. Gossip is, I can't confront the gorilla that weighs 100 pounds more than me or that other gorilla. So I'll go tell you about it.
Oh, that
the reason,
never a good idea.
The reason she's telling you about it is because when I vent to you and unload, I feel better. I secrete serotonin and dopamine, but I didn't solve anything of the problem. Yeah. So you got to turn around gossip. When someone starts gossiping, you got to stop and say, whoa. I don't want you to tell me this because it'll make you feel better, but it's not going to work the problem. You're talking about Jan. You need to go talk to Jan because then you'll get it off your chest. Then you'll feel better. Jan will hear the information. You guys will work this out. This is misdirected monkey behavior. And the misdirected monkey behavior will make you feel better. The problem isn't solved. So then 2 weeks later, you're going to come back and gossip more. Good point. And just gossip is misdirected communication.
Yeah, and that is so common in offices. You're right.
Or just in any social setting.
Anywhere, yeah. I guess with our dental setting, if you're a young person who's well qualified to do your job, remember you have that common goal. You and the person who's twice your age. You all want the best for your patients. And if you are going into a conversation with that as your mindset, that'll help empower you to get over a little bit of that fear. It'll still give you butterflies, but it won't be as bad.
Well, I rarely ever bring someone back for seconds.
Thank you for having me.
But I had you back. You're an amazing person, and thank you so much. And enjoy your vacation here in Scottsdale. I hope you have fun. And thank you very, very much.
Thanks so much.